She wakes up early, shows up for work, for family, for everyone. She pushes through fatigue, ignores the headaches, adjusts to the irregular cycles, tells herself it's all a part of life. But what if it isn't? Because when we look at the data from Apollo Health of the Nation Report 2026, a different story begins to emerge. Even after menopause, when menstrual blood loss ends, women's anemia rates have stayed above 40% in our cohort. This points to a lot of nutritional and absorption factors that go far beyond just menstruation. B12 deficiency. Now, that has been found to be peaking in young women, where that's the year or that's the time of their life where they need the peak neurological health and their reproductive outcomes depend on it. That's when they show up with B12 deficiency. We also found 1 in 4 women with thyroid dysfunction, predominantly hypothyroidism, and that actually sharply rises above the age of 60. And then also, by the age of 50, many women have what is we call as central obesity. It's not just a weight or a cosmetic issue at all. It's more related to fatty liver, insulin resistance, and also cardiovascular risk. So, this is what we find as the silent health story of Indian women that we have studied across different life stages. So, to help us to understand this and figure out how this can be addressed, I'm joined by Dr. Shreeja Gurrala from Apollo Hospitals, Jubilee Hills, Hyderabad. Dr. Shreeja is an obstetrician and gynecologist with over 7 years of experience with specialization in urogynecology and management of pelvic floor disorders. She is also skilled in several laparoscopic procedures, offering minimally invasive care, and also is focused towards patient focused and patient centric management across a range of several of women's health issues. So, Dr. Shrija, thank you so much for joining us today. So, I'm going to begin by asking you to comment on these numbers that we saw in the Health of the Nation report this year. And do they actually reflect in reality with, of course, these are data points from people who underwent the Apollo health checks, but do they also reflect women in your practice? Is there a large preponderance of women who have been putting themselves last for many years?
I would say it's an absolute yes. Okay, so the number of patients that we are seeing today that enter into the OPD have either of the problems. See, they are either having a hypothyroid issue, or they might be having insulin resistance, they might be having a borderline diabetes or hypertension, and they just put in the frame saying, no, this is because we've come to the hospital, we are having blood pressure, or we've just, we've had sweet yesterday night. That is why my HbA1c has changed. So see, they're not even ready to take the fact that this HbA1c is showing your 3 month sugars and not yesterday night's laddu. We do not accept it at all. And the only thing being your corporate company is pushing you to get a test done, health check done, something for a Women's Day, something for a Mother's Day, You have some situation that is very, somebody is asking you to get a blood test. That is how people are coming forward and getting themselves checked. Otherwise, women is always in the end. She puts forward everybody else in the family, and she's always standing behind behind the line. And I think the numbers actually are lesser. We are seeing more numbers. The only point here being the patient comes, gets a health check done, and goes away because they will send the same reports to some friend or, some
Or
family
they'll
member.
read it themselves and feed it into Chat GPT and then, kind of reassure themselves that it's not very bad.
Some doctor, be it Ayurvedic, be it Unani practitioner, anybody. So they would just send the reports to them asking, oh, my HbA1c shows I'm a pre-diabetic. Is this okay? And they would say, yeah, this is fine. You just control your sugars, which is never going to happen. And they're not going to get back to the, physical training or anything like that. So yes, they are huge numbers, not these numbers. Probably we should think in a larger picture.
And what would you like to say to women to change this scenario, which is quite alarming?
I think body is actually giving you some symptoms, and we have to understand it in the right time. for us to prevent it. Okay, so prevention is always better. We try to prevent things rather than treat them. So for treatment, you would have to reach out to a doctor and you have to follow, you have to abide by the rule book. But for prevention, it's not like that. So even if we say something to prevent a particular disease, I think women have to follow it at the right time so that they don't end up having problems later on in life, maybe a 5 year down the line or 10 year down the line when there's nobody else to take care of us, as today's scenario is. Nobody is going to take care of us. We only have to take care of our own health.
That's absolutely correct, doctor. So I think the key message there is that, put your health first as well. So that's that. But we are also seeing in young women a host of these health problems. So let's start with these deficiencies, the anemia. So today we hear a lot of people saying, I'm tired all the time. I'm tired. So while we agree that, there is a good reason to be tired and everybody is kind of working hard, but then what would you advise young women who must get themselves screened for, key deficiencies, which can be easily corrected? And why do they have it? Are these like, is it a large problem? And do we ignore them, or is it because of eating habits? So, what would you like to say to young women?
I think when we talk about young women, everybody is very ambitious, okay, and they want to do everything at once. And of course, here health always takes a last seat because there is no point of health here. We are sleeping irregularly, eating nonsense. There's no home cooked food. There's always something eating from outside. We're not staying at home. We have a lot of stress levels. That is because of the company, be it a project, whatever it is. And females from the age group of around 18 itself suffer through mental trauma, mental stress, the examination stress, and everything put forward. So finally, what happens by 28 is you've lost everything in life. You've lost your major thing, that is your health. So at 28, now they feel old. People who used to tell at 60, no, they used to tell I'm old now. Now 28% also will come to your OPD and say, I'm older, no doctor, I don't think I can run anymore. You are just 28 years and it is not old. You're supposed to run, you're supposed to do a sport.
I think they're just tired. I don't know. I think this whole I'm tired kind of comes all the time.
I think it's both psychological, emotional, your mental strength, everything is just lost in so many other things. If you have some little, that energy left out, I think you're draining it on your Instagram reels and pushing a lot of information in your head. I don't think it's necessary. If it's required, you just go through something and then leave it. Now, it's very common that patients come in and say, I'm loaded with a lot of information, I don't know what to. So the primary information for you is if you have anemia, just get your blood checked. If you have a B12 deficiency, get it checked. No, if you're a vegetarian, you're highly likely that you will have a B12 deficiency. We are all indoor people. We're not going outside. We don't run. We don't work out. We don't take care of our bone health. So our vitamin D is obviously less. So when there is something low in our body, we're supposed to give it so that it replenishes back. There is no way that magically some portion is going to normalize our body. Okay, so everybody says the same thing. No, I will do it naturally. Naturally, how long can you do it naturally and you're not getting anything in an organic way? Okay, the soil itself is polluted. How do you think you're going to get something out of nature? How is nature going to give you something? When we're not working towards nature, nature also cannot work towards us. So it is just foolishness to think in today's world, after so much scientific efforts, when you have a hypothyroid, we're giving you a thyroid tablet. It's a similar thing. If you have a vitamin D deficiency, please take a medication so that you'll be healthier than yesterday. That much is something you should understand. You just don't think that every doctor is looping you into taking medicines, and I don't like taking medicines. This is like a branded statement that everybody
It
gives.
is.
Yes, we also don't want you to sleep late. We also don't want you to eat late. Don't eat too much. You just fill your stomach with nonsense at 10 o'clock in the night or 12 o'clock in the night. You go out for a party, you push yourself with alcohol, you're smoking all the time. All of these are also affecting your health on long term, not today.
Yeah,
So
that's true. So I think it is a complex issue, but as I think the key message is that finally, you have only one body and one life. So, I think you have to somewhere take responsibility for it and try to do what you can. I mean, I know that we cannot romanticize the past and, we cannot all be sitting at home, but I think we can arrive at some via media and try to accommodate healthy living in our busy lives. So now today we also have landed up with many women dealing with PCODs, thyroid issues, menstrual disorders. Many things happen. Are they all interconnected? Also, insulin resistance. I mean, there's also later on developing NCDs. So, are they all part of some common health journey, or are these isolated conditions?
Absolutely, yes. Yes, this is like a entire panel. It's a platter of, the lifestyle changes that happen to our body. And then it starts off with small acanthosis on your neck or acne on your face, a little hair here and there on your face. And finally, what happens is you end up having PCOD. Those irregular cycles are just a sign for you to understand that body is not getting what it's actually required. We are not giving it the right amount of sleep, the right amount of at least that meditation or something has to be there. You have to think about your own self for a little time in the day. Taking care of your own mind and body is very important. So once we lose that, our lipid profiles are off the roof. Everybody has a high cholesterol nowadays. Everybody has a fatty liver. There is some or the other diet that comes up, a carnivore diet or a keto diet or a juicing diet. All the fat diets make the first seats, and all the kids of today's generation are very much tempted towards flash weight loss. Okay, I lose like 4 or 5 kilos in one day or 2 days. See, that is not going to actually help you on longer when you think of a long term. This is a journey. You've put on weight over years. You're going to lose weight over months at least. So give it some time. Give your body time to regenerate. And I think all of the metabolic syndromes that we see are kind of a sitting disease for us. We have been sitting the entire day. We just, the other thing that we do is lie down on a couch. Otherwise, we're sitting on the potty seat, everywhere, we're just sitting or else standing for cleaning and other things. Some patients do say, as we work a lot. What are you working? We're just sweeping or you're mopping the floor. Everything with the longest stick that is available in the market. I think they
No
would go,
bending, no
yeah, there is
flexibility.
no bending, there is no flexibility. If you just sit down once, if you sit cross-legged, you're not able to get up again. Your knees are gone. So at 30, we're seeing knee pains, back issues, the neck pains that are happening. All of these are because of your lifestyle diseases. And PCOD is just a part of it. Okay, so it's very obvious that if you have an irregular cycle, your egg is not going to release, and that is going to sit there. And finally, multiple eggs together look like polycysts. That's all. So that is the polycystic ovarian disease. And then it's not coming out, you're landing into infertility because the egg is not releasing. Finally, you're roaming around infertility centers. What was the mistake here is that you're not treating the root cause. If you have acne, you're just applying something on top of it. If you have hair, you're just getting laser done. Why are you not thinking about the root cause? Every person has to think about a root cause. And if a doctor says or comments about the root cause, they're not going to go back to the same doctor again.
Yes.
Absolutely. So they're not at least concentrate on your diet. 5% reduction in your weight would make wonders in your regular lifestyle. So I think everybody has to take care of their own weight. Obesity has become a very normalcy today. So if a child is obese, they say chubby, and if an adult is obese, they say I'm just healthy, or
But
it's just
Dr.
genetic.
Vincent, if I might interrupt, there's also this other spectrum, as you said, no? There is this obsession with with some kind of a impossible body shape. So that again, I feel is something that a lot of girls, a lot of people, by girls, I feel that even women, they spend their entire lives being obsessed with some perfect image, which can never. I feel that there's a little bit of acceptance with age, body changes. So I feel that I would like to say that that also is equally important. But yes, of course, there is a lot of obesity and weight gain as well.
I think we're just waiting for somebody else's approval of our own body. Okay,
Yes.
so what is more important is being healthy. If you're doing a workout at least 2 or 3 times in a week, I think that should be sufficient for you to have a glowing skin and a healthy body. That's it. So your
Yeah.
body is going to talk to you.
Yes.
And you don't need these fake images that you see on Instagram saying, our life is super healthy. No, I don't think it really is. It's just a media thing, and I think we should come out of it. We should actually enter the reality and think of ourselves as people who are living. We're not a
Yes.
media person.
Why not? Also, you also spoke about this earlier. I mean, the phenomenon of people always giving some reason or explanation for something. Like, they say that fatigue, yeah, we are tired, lot of work. And then if it is like weight gain, is like, yeah, with age, menopause. And then irregular cycles because of something. So, people always make all these excuses to themselves. So I want you to give a quick advice to women on when they have to kind of I mean not trivialize their symptoms, because sometimes and also this whole thing is pain is part of life, because that's a famous saying which people always say, periods, very painful periods, it has to be, every woman has to go through period, then the labor, this, that. So, I mean, that's not always true, isn't it? So, when do women have to, how can they be a little more proactive about their health and not think everything is destiny and fate and we are all doomed to be like that?
So firstly, if you, as you said, no, if it is that tiredness, if it's actually coming up every day, then I think you have to visit a doctor. See, it couldn't be just a vitamin D deficiency or a B12 deficiency. It could be as serious as severe anemia also, which is affecting your cardiac, parameters. And if we just leave few things, it is going to affect you permanently. So that shouldn't happen. So if we want to avoid all of those consequences, I think we have to reach out to our doctor as early as possible. If you find something is abnormal than yesterday, I think you have to reach out to a doctor. If you feel something is not right in your body, you have to meet somebody who knows what it is. You just can't talk to your sister or your friend in the office saying, I have this. Do you also have this? Or have you seen somebody having this? See, your friend might have seen some XYZ having the same issue and who have been normalized, but every person is different. A doctor has seen 100 more people than your friend. So I think they would know better than your friend. So please don't ask opinions for somebody around your house or your aunt or your mom. It's it's as easy as finding a doctor online or just going to a doctor, taking an off from office. I think you're just spending time for yourself. It is not a time-based process. All the patients feel, it's just a time-based thing that I'm coming to you. Sometimes as big as cancers also can be found out by a simple blood examination. So only when we recognize such things, and the tiredness and everything cannot be related to only a B12 deficiency, only a vitamin D deficiency or serum ferritin. All of these are basic things, of course, and you would be obviously popping some multivitamin or a magnesium pill in the night for you to sleep. The first point being, we're not observing about the root cause. We're not taking care of it. You're just scrolling through phone and taking a magnesium pill or a melatonin pill in the night and you want to sleep. So this has become a fashion. Just because something is trending on social media, people also want to do the same thing. Other than that, they don't want to find out what's happening with them. And if you really have a problem, it is so easy for us to correct it at an earlier stage rather than doing it at a later stage.
Of course. So I think that message came loud and clear, doctor, that, the time is now and you have to take proper professional help, not just rely on some third person's opinion. So I think this will definitely help our viewers to understand that women's health cannot be postponed, it cannot be ignored. The body keeps count, and sometimes you have to. Nobody else is going to look after. I think you have one life, one body, and you have to take care of it. And to learn more about this, dear viewers, we have the our Health of the Nation 2026 report, which is on our website. So please do download it, read all about how the rest of the population, how India is faring, how other people like you are faring as far as their health, their fatigue, their nutritional deficiencies are faring, how things are working out for them, and also be inspired to take charge of your own health. And I really thank Dr. Shreeja for her very impactful comments today. So please do take it to heart and please go through the report as well. And we're always here to help you. This is Dr. Srinidhi Chidambaram here. Thank you so much. Namaste.